Penny Roberts, I have yet to be diagnosed, but I have a neurological and musculoskeletal disorder. What could this be? Penny, so many different options, anything from MS to lupus, uh, fibromyalgia. The problem is that there's no diagnostic test that determines exactly what the disease process is. Most of the time, these diseases are a diagnosis of exclusion, which means that we ruled out that it's this thing, and so now it must be that thing, or we're going to call it this. For instance, there's no lupus test that says, okay, this is lupus and nothing else. There is no test like that. There is no test for fibromyalgia. Fibromyalgia is a diagnosis based on your symptomatology. So the doctor has to listen very carefully as to what your signs and symptoms are, then come to the conclusion that you have fibromyalgia. But it doesn't necessarily have to do that. It may not necessarily happen that way. So you need a good primary care doctor on your team. You need a good possibly neurologist and or a rheumatologist. This is going to have to be a team approach. You need to make sure that all of these doctors are communicating with each other, and so that and not just running with one diagnosis. I had a patient today, a case study that had shingles, broke out on the back, and so very painful when it happened. So he was taking pain medications, anti-inflammatories, and once the doctor took him off pain medications, he was using patches to control the pain. And the pain was going on there. He's going into the second year. Imagine hurting like that for over a year. And he finally went to the doctor, a new doctor. The doctor looked at him and saw that the pattern of the area where he was hurting was exactly the pattern of the patches that he was putting on. So the problem was he was not having post-herpetic neuralgia. What he was having was an allergic reaction to the patches that he was using to control the pain. Once they were stopped, within 2 weeks he cleared up and been symptom free ever since. But it took someone with a fresh new perspective. The problem is once you go to a doctor and get a diagnosis, if you go to somebody else and they see what that diagnosis is, they ride with that. Sometimes they don't do an individual assessment. That's why sometimes a second opinion is a total waste of time, because if somebody has already given you a diagnosis, and don't let it go into your medical records or on your hospital records, because then you have that and that only. Nobody else is really even looking for anything. I have to tell when I'm doing lectures to other physicians, I have to say, remember, you're the smart kid in the room. If it doesn't make common sense to you, or just because somebody says it loudly and with enthusiasm, doesn't make it right. Sometimes you have to do an independent assessment to see and to make the correct diagnosis of the patient. So be patient, communicate with your healthcare providers, make sure that you have a dialogue going back and forth. Don't let them fast talk you or just quickly push you aside, because this is a diagnostic dilemma. Some people don't like that challenge, and they got other people to see. So they'll just, placate you with, a new medicine, a new muscle relaxant, a new pain medication, and then move on to the next person without really trying to give you the time and attention that you need. So make sure that you're being evaluated by a team that is working to optimize your diagnosis and optimize your outcome so that you can be the best that you can be through this penny. Thank you very much. We appreciate it.